I'm Cyndi Brandenburg, and I am an associate professor in the core division. And today I'm going to talk a little bit about a course that I teach that's called Global Human Rights and Responsibilities, Core 320 in the core. The big picture, what I hope students will ultimately take away from the course, and an example of a way that I try to get students to grapple with complicated global issues with an open perspective and the right kind of inquiry. So let me begin by talking about the course. These are not the stated learning outcomes of this course, but ultimately there's three things that I want the students who take me to walk away from the course understanding. First, I like them to understand that there are underlying structural contexts and realities that dictate people's lives, and that these structural realities are really hard to see. In fact, they're sort of invisible until you start looking. But once you look, you can find them, and then you can appreciate the ways in which people do or do not have agency and the impact of power and privilege in a global world. The second thing I want them to take away is that intercultural competence and understanding are really hard to come by thoroughly, but totally worth shooting for. I want students to understand what they don't know. I want students to acknowledge that. I would never want a student to do more harm than good by thinking that they're interculturally competent, because the majority of us aren't. But I want them to keep trying to be as interculturally competent as possible. And the third thing I want them to understand is really a little bit of critical cosmopolitanism, the notion that they are in fact citizens of the globe, whether they like it or not. And our actions do impact people near and far, whether we believe that to be the case or not, and that each student has a choice about how they're going to enact their global citizenship. And if that student chooses to be apathetic or to not care, I guess that's okay, but I want them to own that. That's an intentional choice. So those are the three big takeaways from the course. One of the texts we use in the course is this book, Cosmopolitanism, Ethics in a World of Strangers by Kwame Anthony Appiah. And for me, what's interesting about this book and what's really helpful in teaching the course is that he tries to move past universalism and cultural relativism to a place where people can have complicated conversations that can grapple with the differences, shared or different values, practices, and global understandings and priorities. So pretty early in the course, I try to get students to use some of the concepts from this book by exploring the topic of female genital circumcision, cutting, surgery, or mutilation, depending on what term you choose to use. So usually in about the second or third week of the class, I will give them a short piece written by Nicholas Kristof called A Rite of Torture to read that grapples with this topic. I'm hoping that by giving them kind of a loaded, difficult topic, we can dive right into considering the ways in which a cosmopolitanism viewpoint can help tackle human rights issues across the globe. My goal ultimately is to get the students to be able to continue the conversation, to enter a conversation and continue it, even if they're uncomfortable. So I give them this piece to read, and for many students, this is the first time they've ever heard of it, and for most students, they're uncomfortable and even disgusted with the practice. So before we delve into the practice, I tell them that we're going to take a critical look at ourselves first, to see if we can. Okay, this is what I'm trying to do. Encouraging honest, accurate, and assessment of ourselves can advance the conversations we want to have with others about uncomfortable practices. So we put the female genital cutting issue off to the side, and instead I have students consider some of the own practices that we embrace culturally that have to do with body modification, in particular in children. So I break the students into groups, and I let them choose any one of the following topics to talk about in a group. The topics that I propose using are congenital adrenal hyperplasia, virilization, and genital surgery. Intersex surgery for ambiguous external genitalia, sexual organs, or sex chromosomes that deviate from normal expectations. Male circumcision. Piercings. Growth hormone therapy. Braces. plastic surgery, including rhinoplasty or breast augmentation or other, and treatment for attention deficit disorder. These typically are topics that students sometimes, in some cases, have experienced themselves or want to know more about. So I ask them to consider in their groups, these are things that we do in our culture, how we can account for these cultural practices, what we would need to know to understand them, whether we can find the root causes or origins of these practices, what common ground might exist about why we engage in these practices, and what shared values might be at play. So in their conversation, what I really hope that they're going to walk away with are some of the ethical principles and values that are important to appreciate when we're talking about these kinds of complicated topics. Autonomy of the child, the role of a parent in making decisions for a child, the future welfare of the child, the cultural expectations that impact the future success of a child, universally shared values versus cultural imperialism, the goals of medicine, limits to parental decision making, and how we culturally define things like normal, abnormal, atypical, illness, or disability. Once they've worked through all that and recognize that there might be some problematic there might be a problematic nature to some of the practices we engage in if you haven't thought about it really deeply, then I give them a series of materials to go back to looking at female genital circumcision, cutting, mutilation, including a very extensive document that the World Health Organization has produced, a piece that was published in the Hastings Journal, which is a bioethics journal, and a rebuttal to that piece. A map that documents the prevalence of the practice globally. And then I say to them, I think now you're ready to try to use an actual framework to consider this issue. The framework that I like them to use whenever they're tackling a question of human rights is the following. First, the question to ask is, how can we determine whether or not a human right is being violated in this instance? Second, how can we account for those violations and put them into a cultural context? Third, can we use our knowledge or evidence or understanding to find the root causes of this practice or the situation? Fourth, is there some common ground here? Are there shared values at play if we look beyond the practice and the reasons why people do it? Fifth, are there reasonable avenues for promoting change in this case if we think a human rights violation is in fact occurring? And last but not least, what if anything should we do? So those are the questions that I like them to ask. By flipping the lens on themselves, I think they're more able to ask those questions when they're looking out at something that's unfamiliar to them. I've had good success with this and have elevated, I think, the level of the conversation about the topic to a place that I feel pleased with. So once again, this is all really, in my mind, to get to the end game of the course, which is about understanding structural realities, understanding intercultural competence, and understanding what it means to be a critical cosmopolitan. That's all I have for today. Thanks.